Thank you, Shailaja. As I was looking at the pictures that Shailaja was showing, I was reminded of an anecdote that I heard 2 weeks ago. So I was in South India, in a fairly rural part of South India, in the district of Bagalkot, and we were talking to the superintendent of police over there. And he told us about a crash that had happened 2 days ago on their state highway. So state highways in rural India are these two-lane roads with no median barriers. They're small roads. What had happened was that early in the morning, a group of people came and they started doing exercises, morning exercises. They were just working out standing on the road. They put little bricks around themselves to protect themselves. And a car came and drove right through them. Now, he was obviously pointing out that these people need to learn that that's not what they're supposed to do on the road. But if you ask these people what they were doing on the road, I've been asking myself, what answer would I get? Why were those people standing and exercising on the road? Oh, there's more to the story, by the way. That little group of people were exercising together because in the previous week there had been religious tensions between Hindus and Muslims, and this was a group that had gotten together to exercise together as to try and patch relationships. In my view, so I don't know what the real answer is, but when I think about that anecdote, those people had a very different understanding of what that road was supposed to be about. They saw that road as a public space for public activities that they wanted to do. The superintendent of police and me and many of us in this room have a completely different understanding of what that state highway is supposed to be about. We want those people off the roads, the people who are using them as public spaces, and we want to make these roads for cars, and then we want to put safety infrastructure on it. We want to put median barriers, we want to put safe pedestrian walking sidewalks. But if we did all of that, chances are that the road would be safer, but I guarantee you that there would be a huge loss, and that loss is going to be on the social justice issue that came up in the first session. People who thought of this road space as a completely different sort of environment for democratic activity would no longer be able to do that. And the reason why they can still do that in India today is because India is still a halfway democratic country. But our visions of expansion and becoming rich, which means building these big highways, is going to trample that dream of democracy. So when David encourages us to think local, I think that's the battle we were talking about. Okay, so with that, I'd like to invite the speakers to come and sit up front, and I'd like to encourage you to ask questions.
Hi, my name is Alessandra, and I work from PAHO. And thank you for the speaker for the interesting points about risk factors. And my question goes to Professor Pham. You said that wearing helmets had increased in 2007, but however, the rate in injury didn't decrease. So what interventions are being done to improve the correct use of helmet and the standardized helmet in the government?
Yeah, according to our, we also found that the problem, and we figure out that there are some issues, and three of the big issues that we bring out that the incorrect use of helmets and also non-standard helmets. And I think recently, a couple months ago, our government also released a new regulation when they put the enforcement for the incorrect use of helmets. And also our government also put the regulation on the enforcement on the non-standard helmet by asking police to stop and to check. But be honestly, it's really difficult for the police to enforce the non-standard helmet because it's very difficult to recognize the what is the standard and non-standard helmet by looking at people when they're traveling on the street. But and some and in the meantime, there are a lot of work for the police, and they are not willing to do it. And I think that our government also have some solution, but I think it's not bring a good result at the moment.
Hi, Suleiman Alnam. My question also pertained to the use of Halkman. When seat belts and airbag were introduced in the United States, there were some talks about what they call the Boltzmann effect, that when you present people with preventative strategies, they may actually feel more powerful or more inclined to speed because they think they are more protected. Was there any study or intention to sort of measure has motorcycle driver became sort of change their behavior, which may explain some of the negative finding of its effect?
We also have some study and to see with the strong enforcement of the government and the society, there are some change because at the beginning, before the helmet law, we see that only less than 10% of people they willing to wear the helmet and they find out the standard helmet. They buy the standard helmet to use it, and it's now when you see that the proportion of wearing standard helmet and think the helmet will protect them is about 50%. So we see that there are some change in the population, the increasing people, they willing and they use the helmet as a protect device. But I think there are still large proportion of the population, the motorcycle riders, they still use the helmet as the way to avoid the police. But I think that is some issue. But there are some change in behavior. But I think that is not as we expected. There's still a lot of work to do. But we do have some social marketing. We do have some training for young rider in the university, in the high school, and we also have lots of public announcement and social marketing campaign to raise awareness and the behavior of the people. Yeah.
So if I understood Suleiman's question correctly, he was speculating that people who are now wearing helmets might be driving more dangerously because they think they are safe. Do you think that is possible?
I don't have the data to show that people wearing helmets. I don't have the concrete answer for that. But I think that there are some, especially for young riders, they think that they are more protective and they can drive faster. But we don't have the data to say.
Guru Raj?
Thank you. I think all the three presentations were really very interesting and very excellent. I have one question and one comment. My question is to Dr. Pham. With specific regards to helmets for children, it has been quite a controversial area in many of the low and middle income countries for a variety of reasons, including something like non-availability of child helmets, to the appropriate standards that needs to be developed for child helmets. Thirdly, the non-availability of manufacturers who can do such type of helmets, and also whether any cost-effective studies have been taken up on a large scale in many of these countries. So there are a number of these things. Specifically what I would like to know is, in Vietnam, since you have tried out this, do you have any specific standards for child helmets? Secondly, are most of your helmets, because you also showed that there are many non-standard helmets that are floating around in the society. So are most of your helmets imported helmets or locally manufactured helmets? That's my question. My comment is with regard to Dr. Shailaja's presentation. I think she has given a very wide picture of many things that contribute for road traffic injuries in India, and also same thing is true for many low and middle income countries as well. But that also brings up an issue in terms of what is it that we can do. As road safety professionals working more in low and middle income countries, we are fully aware of the fact that we will not be able to address each of those factors that she listed, from the behavioral and the societal factors, both at micro as well as macro levels. And in a situation like that, when it is not possible to address each and every factor that can directly or indirectly in small amounts or in large amounts that can contribute to road crashes, what is it that needs to be done? One of the important things that has been understood all over the globe is that road safety cannot be addressed by small individual initiatives. In every country, we need proper road safety management, proper road safety systems, through which we can address road safety in a more scientific manner. Secondly, a large number of factors may be difficult to address because of the social, cultural, and many other factors. But there are certain things, through experience of the world over the last 4 or 5 decades, which has shown that there are certain things that really work. And they've been shown to work. And I think we need to give importance for those that have been time-tested and find ways of implementing in our society so that at least we take a step in the right direction and start addressing it at the early stages. We need to invest a lot in research, and like Kavi said, the highway which he mentioned, we still are not very clear about how our cities should be designed, how our highways should be designed, what type of infrastructure facilities that we need to put in. These are all big questions that still await answers. But while we continue to find out what more needs to be done, I think there are many things that can be done which have been time tested. Thank you.
Yeah, thank you, Dr. Gurura. Regard to the standard for helmet for children, actually we don't have yet for the standard in the country. We have some standard for adult, but standard for children we don't have yet. But some factory in Vietnam, they try to produce the helmet, but they use the same standard for adult, but make it lighter and make it smaller, so they can advocate for use for children. But I think that the society, they not well accepted, because many parents, they think that if you put the helmet on the children, especially for small children, it could affect for their spinal cord and or something bad effect for their child. So they don't want to wear it. And secondly, that the helmet among children is not in high proportion, because the government is afraid they not make the regulation that require all children have to wear, but children under 6 don't need to wear. So it's also some difficult for enforcement how to identify the children under 6 and above 6 as well. So there are many factors that still prevent the children is not wearing helmet in Vietnam. The second thing is the non-standard helmet. Yes, at the beginning there are many helmet import from other countries, but I think that nowadays in Vietnam they produce local factory or some small factory in Vietnam, but they not register at the helmet. They said that they produce a plastic cap, or they produce the plastics like this cap, and the government is difficult to enforce that. And some of them is not, some of the agencies, they difficult to make a regulation because it's not a helmet. So why we stop them? So I think that is some difficult, but it made locally.
Can I respond to
Please,
Dr. Gururaj?
yeah.
Thank you for that comment, Dr. Gururaj. I know that there's been so much information on risk factors, and we talk about the same risk factors again and again. And this talk concentrated more on the risk factors and very little on, or nothing much about solutions that we can use. I think what we can do is to have more evidence on interventions, locally developed interventions, and out of those, what are the interventions that work for India or for some cities, because India is a huge country, and something that might work in one part of the country may not work somewhere else. I think this would be good to have in terms of large-scale interventions, and also more important is to evaluate those interventions and scale them up further. Yes, a lot has been talked about risk factors, but very little about interventions and how to address these risk factors.
Professor Pechansky.
Just to make a quick commentary on this issue that you were mentioning. There are studies showing that social deterrence and perception of how swift and certain the action of enforcement will be may result in change. We're not talking about thinking, we're talking about just the behavior itself, if you could separate one from the other. Basically what I'm saying is that in places where enforcement is very strict and fines are very high and immediately taken, the results in terms of behavior are better. Of course, this collapses with the individual versus the social conscience. People won't do this because they are respecting others. They're doing this because of their pocket. But it does work in some areas. And there's many studies that show that people who move from countries in which these regulations or enforcements are lax and go to countries when they are strictly enforced, they change their behaviors. Not because they had an immediate perception that has to be done, but because it will hurt their pockets immediately.
Deepan.
So I had a question on a follow-up to that point. I mean, Deepan Bose. I had a follow-up question on that, that when we talk about these social factors, both, drink driving, alcohol, usage of restraints, I have sometimes issues understanding how it is being, like the data that is presented, the number of, positive tests done by the enforcement, over time, and how to interpret that. And based on that, something that this morning Dr. Vishai pointed out, that, how many miles do we need to drive or travel before we become in the risk group of 1 per million. So has there been any attempt to look at these risk factors, that how many miles do I need to drive before I will be stopped for a breath test, or how many miles do I need to drive before I will be checked for speeding or restraint use? I think that is, for the general population, that deterrent of, being stopped by enforcement can have a much more, a better sense of where we are going with these risk factors, rather than just looking at isolated pockets of, on a particular night, how many of them were tested positive. So if you had any comments on that, appreciate it.
Thank you. I think this is a perfect question of which I do not have a perfect answer. As we all know, you can increase the number of positives by just getting the better measurements, like prevalence studies, right? And so when police comes and says that they've done more breath tests, it doesn't really mean that, it means that they've been on the streets more often. But for some reason, there is some perception, and I think this has to do with social deterrence, that if you are enforced on a more regular base, you will feel that it will happen to you. Like, for example, the average time in which you will be caught on a roadside breath test or drug test or field sobriety test in Brazil is very low compared to Australia, where the average would be something like 7 to 10 times a year, and you see that happen. So I guess that the perception changes together with the prevalence, if you understand what I mean. But I don't think there are studies specifically on what you have asked. How many miles should I drive before I get on a road barrier to be tested for drugs? Very interesting question, by the way.
We have time for one last question. I think Professor Haider was about to put his hand up. Is there anybody? All right.
Okay, well, I'll just be really, really loud. Kate Allen from Hopkins, and on the subject of enforcement, all of the presenters touched on the political context of getting some of these laws passed. So I wonder if you could speak a little bit to the challenges of getting, legislation pushed through and the follow-up with enforcement. So I was going to focus, I think, purely on the legislative aspects of the work for
It's going to be very brief. Thank you, Kate. If you read what's in the Brazilian law with regard to drunk and drug driving, it is very strict. It's a zero-tolerance law for alcohol, for example. So the problem is not the law, it's the enforcement of the law. And one of the things we're seeing in Brazil right now is the more empowerment that you provide to the people who are right on the street enforcing the law, the better the results will be. And it has nothing to do with equipment only. It has also to do with the perception of the police itself on their role and duty. But the laws are kind of separated from enforcement at this point in Brazil. And all these things we're seeing is trying to bridge this gap.
I'll quickly add to that from the Indian perspective. The law is there and it is quite strict, and we have a stringent blood alcohol level testing. The level itself is very stringent. Again, when it comes to enforcement, it is not systematic. But there has been a change in the last 3 years. From 2011, at least in the city that I come from, there has been heightened enforcement. And from then on, we have seen a slight change, a slight reduction in the prevalence of drink driving, which may not be attributable to just that particular enforcement that's happening. Maybe there are other factors, but there have been more visible checks, fixed point checks on the roads, but they're more visible. So maybe it plays on the behavioral aspects again, where people think that if I go on this road, there might be a check. Today's Saturday. Although they know that they're fixed points, and people do make U-turns and run back. But it has been more visible than before. Thank you.
So it turns out we do have time, a little bit more time. So if you have questions, please raise your hand. Professor Haider.
Thank you very much for all the three panelists. My question will be for Flavio and Shailaja. I think in some ways, if we look at who ingests the drugs and alcohol that you were talking about, Flavio, it seemed that you had some differences between different target groups. And in some ways, maybe that's a social determinant as well. And the question that I'd like to pose to both of you is, how do we flip these around in terms of informing our interventions? Behavior change is a big issue for public health in all aspects. It's not just for road safety, it's also for tobacco, it's also for chronic diseases, it's also for exercise and what we eat and so on. So it's not so unusual for public health to consider this. But either we wait for people to absorb the lessons and internally change, or we use other mechanisms to create behavior change strategies. And I'd like you to reflect on that a little bit, because I wouldn't want to end the session without the sense that we have tools to actually influence behavior change.
Let me start. There's one change that has been put into place in Brazil with regard, for example, for truck and bus drivers, because they drive long hauls. This is why they tend to abuse amphetamines or similar drugs. So there's been a new law in which they have to take shifts and to spend more time resting before these, they drive less hours per day. We are about to see whether this reflects a change in their drug behavior. But it is an example in which you can pass a specific law aimed at a specific behavior group, if you want, that would address their drug behavior. Because if you take it from the drug behavior itself, it may not be the answer, like avoiding alcohol on the roads. It would not naturally mean that people will drink less on the road. They could get into a city, drink, and get back to the road. So it's a mixture, it's a combination of things. But this is one that came to my mind, Adnan, that seems to have a positive effect. We'll have to see, we'll have to measure that.
Yeah, I'll react quickly to that. I don't think it's going to be in the minds of people in India, especially, to think that they want to be safe or careful, and that's why they should not drink and drive. I think enforcement will, continued heightened enforcement will be the key in Hyderabad, because there has been a change in the way people perceive drink driving and the perception of risk of being caught. Earlier, the tickets used to be given, but more erratically, and also it depended on the discretion of the police officer at that point of time. But since 2011 November, when this official launch of drink driving was done in Hyderabad, they've made the system more painful, which means that when a person is caught for drink driving, they impound the vehicle. And then they keep the vehicle, and then a huge pile of vehicles in police stations in India, and they don't know what to do with those vehicles and they do this in the night of the Friday, for example, till Monday morning they cannot get their vehicle back. And the other painful process is that they need to take the challan and go to the court on Monday. And that adds another layer of waiting for the vehicle. And I've talked to the police who have said that it is stigmatizing to them to go back to their children and say that the father does not have the car anymore. And they have to wait till Monday morning to get it back. The other layer they have added is that the people have to sit through a long session of counseling. And they meet other people who have been caught for drink driving. So all these are layers that are added to it just as a deterrent, perhaps, and over time that might work on the psyche of the people. But I feel enforcement is the key now, at least in the condition that we are now in Hyderabad. Thanks.
We may still have time for one more question. Yeah? Do we have a question? Yes, please.
Hi, how are you? Khaled Bastiuni from George Washington University. Two questions, actually. One is to Dr. Pham. You know, I was looking at the data, and as a guy who deals with head injuries that come from motor vehicle, bicycle, motorcycle accidents, I find it very challenging to see the data. 50% of your patients or 50% of your population are using standardized helmets, but there was no decrease in head injuries. You would expect even in that patient population that you'd have some reduction. Is there any guess as to why that didn't occur? And then a second question, which is we talk about policy changes and we talk about kind of the legal aspect of it, but no one really talks about the advocacy efforts that go on to bring about some of those things, which I think are a bigger part of the challenge. If someone could spend a minute or two talking about how you've gotten about getting those policy changes in place and how effective advocacy is in your country. So, thank you.
Yeah, thank you very much for the question. And I think that looking at the data and pointing out what has really happened for us, I think it's still a lot of challenge because we don't have the good surveillance system data in the hospital and in the helmet observation in the field. So we try our best to do it, but I think that even that we have like a 40 or 50% of the population wearing standard helmet, but also they are pointing out in the literature that proportion is not enough to see the reduction. Sometimes you need more than that to cover the whole population to see the real reduction. It might be some location that have changed, but we didn't see like the trend or any real significant on the reduction of head and face injury among the population. That is not, we don't have the concrete answer for that yet. The second point for the advocacy, I also want to respond to it. It's very, very hard process because we work in Vietnam to introduce the helmet law before the year 2000, but that's very easy to government to point out the law. They can put the one sentence in the law quite easy, but how to make it happen and how to involve different partners and how to have the people to produce the helmet, people to enforce the law, and how to advocate different partners and how to make them work together. I think it's real difficult about the year 2000. And then we have a lot of partners involved. We have the international partner, we have the private partner, we have the academy, and we saw the evidence. And we, through the advocacy, I think it can change, it can make it. But I think it's not easy to advocate to change the policy. It's difficult.
Can I respond quickly? So there have been advocacy groups, mainly in HIV in India. A lot of funding, lots of well-funded NGOs doing a lot of work in advocacy, but unfortunately not much in road safety issues. Having said that, there are lots of reports in newspapers, mainly in the print media, which cover road safety issues, and I see that as a huge channel and an opportunity for advocacy. But in terms of advocacy through NGOs has been minimal, and have been very small NGOs working in their local areas. I don't see a huge collective effort in advocacy on road safety issues particularly.
Just a quick comment. We don't have, the way the Brazilian society is built is that it basically relies on government movements, which is a problem. Right now we're facing new elections, and there is not enough social movement on people who are either pro or against government suggestions. We do not have institutions such as MAD, Mothers Against Drunk Driving, or similar very strong advocacy groups as you have, for example, in the US. Our center decided to train police officers and help them understand what their law is, what their duties is, and how we can make their work better. But I would not call that anything similar to an advocacy group. I think it has to do with the way the societies are built. In the process where we are right now, there are other Brazilians in the room, they might want to comment on this, is that we're still relying on someone to tell us what to do, instead of us saying we're mad about this, we want to make change.